And start recording.
Action. Okay. Welcome everybody to the Board of Trustees, Platte County Health Center. We're regular session meeting 6 p.m. November 21st, 2024. Let's do our roll call. So who is in attendance? Kim.
Here.
Susan.
Here.
Me, yes. Mike.
Here.
Zach. Here. So we are all here. Let's do the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Any guests that we need to introduce?
Our first speaker, Mr. Hales.
Okay. Nobody else online like it's just Cindy. That's it. So run the show. Do your thing.
All right, so the first thing tonight is our 2023 audit presentation. And without further ado, I'll turn it over to Kenny. I think probably everyone except Zach was here last year for this presentation. So, this is our auditor, and he'll present on the audit, which you got in your packet and on the table.
Thanks. Thank you again for allowing me to do your audits. If you want to flip to page 13. The 12 don't count, apparently.
13 in this booklet?
Yes.
Okay. Yep.
Not in your agenda. I pulled the last couple of years. This is really your transitional year in getting into this building and getting everything in. So your change in net position, which is your net income, was down for the prior 2 years, which was kind of expected because there's a lot of things, labor that goes into creating this that don't get capitalized that show up as expenses. So the salary line is higher than the prior year by a couple $100,000. But some of that is because of staff. Some of that is because of contract labor and labor costs of putting in TVs and everything else that goes in here. So the next 3 line items in there, employee benefits, repairs and maintenance, and medical supplies, all went up. Shockingly, things cost more than they did prior. One thing when I was kind of putting it together, I looked at some of the things. Some of this was just a timing thing to where, like, if you buy 10,000 Band-Aids in December of 22, you don't use them much in 23, and then you've got a big cost in 24. That's what kind of happened to you on the medical supply side, because you actually didn't have a lot of expenses in anticipation of the move. You kind of got by with what you needed to make sure that you didn't have to move that much more when you got to here, kind of thing. So, which makes sense. But overall, like I say, the number at the bottom, the loss on the sale of capital assets, you did not lose $1 million. Okay, it's really an accounting number more than anything. It's just removing 2 buildings. There's depreciation that goes into that from various levels. Any improvements you had done to the prior 2 buildings had not been paid off yet. So the cost that you had in those buildings were a lot more than what they were actually worth. That changes your depreciation number through the year, and all of that good stuff. So don't look at that and think, oh my gosh, we should have asked for another $1 million on those buildings.
And I know, if I may.
Yeah.
We are tax exempt.
Right.
And the depreciation, which normally companies would use against their tax liabilities, is just an accounting placeholder for how this is going on, because I'm sure it's software.
Yeah.
So that's it. Just wanted to be sure that that's in there, that it's not a loss, and it has nothing to do with the balance of the valuation of buildings,
right,
versus sales.
Correct. Okay. Yeah, it's a lot of times I'll do like water districts that will buy a new truck. They'll have a fleet of 3 or 4, the smaller districts, and they'll replace the 4th one every year. So you're not paying off that truck all the time. So you're always showing especially in vehicles. You're not going to recapture what it was worth on the books all the time. So, but you got to make sure they're functional, much like the medical supplies. So everything else looks pretty good. I mean, Michelle does a good job for us as far as any questions I have, and making sure that if there's something I'm missing, she knows where to get it. It always scares me from the auditor standpoint, knowing that if you lose Michelle or anyone like that, then it's hard to replace that person, kind of thing. So
Since you made that statement, what is it specifically she is doing, or what software is she using that is transmitting you the information valuable?
well, she uses QuickBooks.
That's that.
But she's able to, especially like on the reports for the intergovernmental revenues, all of the program money that comes in, those are pretty well organized as far as everything goes, to know what goes in what category, what it relates to. And I've asked her before, like, what's that program that's called? She goes, you mean, I know which one you're forgetting because you always forget it. It's this, you know. Okay, yeah. So, like I say, she could teach a seminar to some of my other clients.
She's so good, your price will go down next year?
Yeah, but if she gets wind of this, her price will go up.
Your price is pretty good, if I recall.
So because we have so many grants and contracts and different things we bill to, we have to start kind of not only on items, but also with the payroll. So keeping everything straight and keeping it billed to the right place so we can recoup that money, because a lot of it is we have to bill as we go. It's not just you get this big, we may come here and say we want to accept this contractor grant for X amount, but then we actually don't get paid until we provide the service. So we have to make sure that we are billing that appropriately. And then that all funnels down to what Kenny's gonna say.
Once COVID hit, that process went in the tank from the other end. And it became oh yeah, we owe you this, yeah, and you had to really knock on their door to make sure that you were getting your reimbursements. And she was pretty good about that. So if you want to flip to page 30 and 31, that is kind of the detail that she has to go into. She creates those pages that shows each category and what program it is and where it goes. That is required. This is what the feds flip to first, is they want to know what you spend on each program. If it matches what they've got, if it doesn't, then what's the problem there? And usually at that point, it's a timing thing. We did something in November that we got paid for in February, and so we're waiting on that money, kind of thing. So, but like I say, everything looks pretty good. I think you're set up pretty good here now. That 24 ought to be a pretty good base year as far as going forward, what your revenues and expenditures ought to be, and kind of proceed from there. If you've got questions or you reading through this, you can't sleep at night, shoot them to Andrew, and I'll either get you an answer. If it's something you want me to come back and address, I'd be happy to do so.
I have a question, but I don't know if it's more of a you question or you guys' question. So on pages 5 and 7, it says revenue and adjusted expenditures for the emergency preparedness, and then also for public health nursing went down for both. Is that something we expected, or
Yes.
that's just because we're not getting the grant money funding? Is that
Because
the
we're
issue?
not getting COVID money.
It's the COVID money for both of those.
Right.
Okay.
But I mean, yeah, this is 23 was kind of the year that it came off being an emergency. The money was already spent. There's actually a contract or grant. Dan and I call them exactly opposite, so I have to call them both, so we both know what we're talking about.
Right.
But epidemiology and laboratory capacity grant, we were very good about spending that money, a lot of it, because we rolled it into things we were spending on the building, like the generator, equipment here, vaccine refrigerators, and we spent all our money by what we decide May of this year.
Yep.
Come June, I think CDC changed their criteria. And all these other health departments across the state are super angry because they changed the criteria and stuff they had budgeted for. They're not able to, and some of it's people.
So it's a
And
shortfall.
so they're having to re-justify everything. I think every meeting we're on, people are super angry. And Dan's like, we did good. We
Yeah.
did, like, we
Well,
had the
so
money.
then that begs the question, how did we compensate with the other department, the other different things? Because the other ones we did really well with. So it's just those two were specifically
Those
targeted
are
for COVID,
Emergency response
And
and
the-
nursing.
but all the other
Yeah.
components were totally fine,
Well,
supposedly.
you know, we had people that were billing to those, but it was not nearly the amount.
Okay. That was all the questions I had. I don't want to take up more time. I was just curious how that works. So that makes sense.
Do you have anything to add to that?
I know Dr. Chaffee got to hear a little bit of that frustration when we met in Macon with the senator back in October. So,
Because they were talking about it there too, weren't they?
and she actually did address it, contacted the Missouri Department of Health and Senior Services and kind of gave an explanation of how they're finding funding to kind of ease some of those concerns. But yeah, they're working on it. So she's very proactive and gets good results, I think. So.
Okay, excellent. All right, so anybody else have any questions, concerns, compliments, anything? I thought you did a good job.
Thank you for the brevity.
Yes.
Thanks. It's all in the packet.
Yes,
No, and easy.
Thank
we
you.
appreciate it.
Thank you for your
Thank
time.
you.
Yep. Have a good night. Okay, let's roll the next topic.
Okay, so the next thing is slope health. I do talk about it a little bit in my report.
Approval bills.
Huh.
Approval bills.
Oh,
And minutes.
Oh, yeah, we didn't even do the minutes yet.
Minutes.
Whoa, pump the brakes.
Mhm.
Call. Okay, let's do the minutes real quick since that's what we're supposed to be on, right? Pretty much. Okay, so anybody, the minutes start after the audit,
Page 40.
page 40. Yeah, there you go. Okay. Anybody see anything? I did see something that's kind of funny. It says our meetings are always at the Kansas City facility as opposed to
the bar.
at the bar. Okay. Okay. Anybody? Do we have a motion to accept and then approve?
I move that we accept the minutes from the meeting on October 17th.
Do we have a second?
I'll second that.
Any further discussion? Okay, let's vote here. Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
Okay, it's moving on. Approve of the bills now, or do you want to wait till later? Okay, yep.
So Cindy Cogan, would you please make a note to change the minutes to say the health department facility?
I just thought it was
Just
just,
so it's not giving the impression it's one of our multiple anymore. So one of the things in my part of the report is we do have a number for how many visits they had at the clinic. Now that it's 100% run by Slope Health, it's 55 for October. In October of 23, it was 96 visits when we ran it. You know, this was their first month, so we expect that to go up, but it is a number that they are giving us.
so those 50, those are our patients coming back, or that's their patients coming here?
It's going to be a mixture of both. That's how many they saw here.
Okay,
That'd be a little harder to get, I think,
Yeah, I can.
to know who was who,
They're
but
established.
we kind of want to just make sure we're utilizing the clinic
Right.
and increasing throughput.
and hopefully there's a lot of word of mouth.
Yeah, I know a lot of them were former patients of ours because they'd see some of our nurses and staff like, oh, hey, how you doing?
Right.
So like, oh, sorry.
Okay, that's cool. Okay,
And then on the 30th of October, the day before Halloween, we had an open house It was well attended. Dr. Kingsley did a great job. He signed autographs after his
I
presentation.
did a puppet show. It was awesome.
I made a faux pas and embarrassed Kim.
It's all right. Kim was
but-
late to that too, but
Oh, yeah, you were there
hopefully
too.
I'm not
Yeah, yeah,
too
yeah.
bad of a run now. It's the last two things I've come to here after late.
But had a fairly good turnout. It was in the papers. So that was fun. That's always fun to see. And in your emails, you should be starting to get just regular media, not advisories, but whenever the health department's in the news, you'll get a copy of that. Just for your information, but it's also kind of fun to see the stuff we're doing is making the papers. I don't really have anything else about SWOPE. Does anyone have any questions?
I thought the event went really well. So and you guys were
It was
there.
very nice,
Yeah, it was
yeah.
really nice.
I think
Nice
it'll
to
be a,
meet some of the people and
Yeah.
I think it'll be a great partnership. So
very, yeah.
it should serve our needs.
Is there
and
been any
everybody
feedback
else's needs too.
from the staff members of SWOPE as far as how things are going, how they feel things are going and use of the space?
They really love it here, and they're very grateful for the space. Like they love the clinic and just the building itself, and how fresh and new it is, being able to use all the equipment. I know we were working more partnerships with them. I know we reached out their Hep C coordinator for any patients. We're going to work on referring any positives we get to them. We communicate with Hep C Alliance, who we contract with, and they're perfectly fine with that. They actually have one of their board chairs is actually from SWOPE. So they're like, we have that partnership, so we're 100% on board. So we're working on trying to do hopefully some more collaborations in the future.
Yeah, I'd say that's one thing I've noticed from Dustin and his team is it's all new blood. And so it's all new resources that they have that we wouldn't have had otherwise. Because before it was, all of our people. And if we had the resource, we did, but if we didn't, we had limited reach. Now it seems like we don't even know how big our reach could be.
Yeah.
Right? So-
I do know they're planning on having a hygienist here, hopefully by the end of the year or early next year. So
Oh,
they already had them
nice.
come in, look at the space and
That seems
select the
quick.
room they're gonna be in. So they're pretty excited for
Yeah,
it.
so talking to them, that was the two goals, is to increase the population and also the dental side of things is what they want to do. So that's a
And I
win-win
think
for everybody.
their dentist, I forget her name, that runs that program was here at the open house. So that's all I have on that one.
I have a question, regarding the first month. I know that we had the intent of monitoring patient complaints or concerns. I don't know if that's something that we want to put on the agenda, at least for the first 6 months, maybe to inquire or address that there weren't any or were, and have those discussions. I feel I have a duty as a board member to try to make sure it's being run properly. I have every expectation that it is. But I think I think we need to be on the record of asking the question, were there any patient concerns? Because we have a responsibility in this transition to make sure that it's addressing the needs of the citizens. So maybe next month we can make sure that we're addressing that.
Put on
Do
the
they
agenda.
do an outgoing survey?
I'll double check and see if that's something they do provide.
Okay.
An awful lot more of some of like their clinic manager and but we did talk to them if they have any complaints or issues or anything, just
Okay.
they know where my office is. We've talked pretty much every time they're here, just to chit chat. So I'll follow up more and
But
see.
Dustin, if you could just add that to your report.
Mhm.
Make sure we get
Perfect.
whether we've had
Oh,
any
that's good.
complaints, and then find out if they do a patient exit survey. And if we could get the
Then we can
results.
do it
on
while
that.
they're here.
Yeah.
Yeah.
Before they leave the building.
But we'll just include that in Dustin's
That's
part of the
perfect.
report.
I think in the transition, I feel the duty to make sure that we have transitioned the delivery of healthcare services to somebody who's doing a good job with it. Because that's our intent as citizens of Black County or other folks. If there are concerns, I think we have to have that opportunity to hear those and to make sure things are good. And advocate on behalf of the patients in case there's not adequate response for their concerns voiced directly to the operators of the clinic.
Well, I will say, once it goes in there, I wouldn't have any intention of taking it out in 6 months. We'll just always put those numbers on the delivery of services, the quality, and the complaints. We'll just keep it. Because we'll have to figure out how they're going to give that to us every month. And I'd say we just want to have that. And it's in the contract, so.
Okay.
I don't think you're gonna be 100% pleased with everybody. I mean, they're 100% pleased with us, but I think that there's trends we need to know about it. That's for sure.
And or advocate and follow up with them because they may have internal quality assurance and CQI procedures that may not get as much attention if the board was to inquire as to an uptick in complaints or a pattern or,
Right.
It's a check and balance.
And probably maybe down the road, a good press thing for us, a good advertising.
Right. Okay.
Thank you.
All right, so the next thing is, hopefully we're counting down the number of times we discussed this topic,
HVAC?
but it is for the HVAC
I feel
CPR
lost.
number 40 regarding
Must be an agenda. Sorry.
humidity resolution. And you do have a contractor proposal request in your packet.
Can you roll up on the screen there to catch up? Hurry, please. What page are we on now?
It's 48.
44, 45.
There we go.
There are a
Okay,
few
yep.
too many Brians involved in this. too.
Yes,
Just
I was
might
gonna say.
Want to side note that.
Go to
A
48.
lot of Brians.
That's the number.
Back to you.
So the amount for this CPR is 57,849. As you all know, Dr. Kingsley and I meet every month at least once. And I think one of his questions was, the general requirements, the overhead, the insurance and bond, where's that always come from? That was contractual when we signed on with them to do for any change orders. That was part of what we had signed up for that to be allowed. To be honest, on this one in particular, Straub has been working many months on this, so I'll just throw that out there. There was so much back and forth with Brian Quisell on different ways he was trying to do it. And I think I probably told Dr. Kingsley at one time, oh, they told me it's going to be quite a bit less than what they originally projected. Well, when they were all here, I think they had said around $50,000. And then they had told me it'd be quite a bit less. They aren't going to have to close down the department. But the price did not. The price went up from 50,000.
Yeah, so we went from 40 almost up to
That's
50,000.
despite the savings of $11,000 on not having to install individual breakers.
Yes. I asked him to come. He said he was unavailable. But he did, in your packet, there is an email from him that kind of describes.
All right, I need to make an announcement for transparency. I hired a contractor to help me with some plumbing issues and evaluate my building that didn't have adequate water pressure on the second floor. He hired Mr. Quisell, who worked on behalf of the entity that owns my building. And he provided me a recommendation and report for which I paid him about $900. That's my business transaction with Mr. Quisell, who is working for as an engineer for Straub. So transparency is important. I don't have the gut feeling of any impropriety whatsoever, but to be transparent, if I'm doing business and I've paid him, I wanted the rest of the board members to be aware.
So I do want to point out, he does not work for Straub. He works for Brian Ruoff with 3F30 Architects.
Okay.
So just so we all know that he wasn't doing this, like whatever plan he came up with was totally separate from what
Okay.
Straub was
No
bidding.
worries. I just wanted to, again, be transparent. In my meeting with him, he had a sidebar discussion with me about the HVAC renovations, and he said, you're gonna get a lot of savings because of X, Y, and Z. I said, great, I look forward to seeing it.
And.
So-
So.
Just waiting for those to materialize.
The initial proposal, they had $11,000 less of equipment. I'd like an explanation from the contractor if it's going up despite the engineer getting cost savings.
So I know one of the things is I did ask for thermostats to match all throughout, which would read humidity.
Right.
And be all the same thermostat and can be able to schedule the fans and that type of thing. It should all be in the line listing of the costs. But
Was that new in addition to?
that was different than what Brian would have told you originally.
$100 each.
Yeah.
Six.
That might
Because
be
it
in
was
here.
about $2,400
Mhm.
for
But then there's,
6 more thermostats.
But
Well,
even then, let's
Yeah.
take away the 18,000, 2,400 from the 18, still $16,000 more than we were expecting.
yeah.
So is
the
it
thermostats
essentially all the
were high.
electrical work? Cause I'm looking at, is it the electrical work required? That's another 11,000 right there. Is that what they're adding into it? Cause it's required above scope of work. So is that what they were not expecting?
Right.
So it's just
Because
pure electrical work.
They don't have to run new wires. They don't have to put in new breakers, but they have to wire them up to the unit somehow, is what I understood.
So the project management fee, which is line item number 2, is if we have a site superintendent, I'm not sure what project management fee is. That is, I'd scratch my head because the site superintendent is doing the management. He's making sure that the electrical, and the HVAC and that everything's getting installed. So that's what a superintendent is for. I'm just scratching my head.
Yeah, those are Straub costs. And I can, if we want to delay this conversation, I can have them
Don't,
come.
but what I want to do is any future proceedings with any HVAC or other things like that. When we don't have an alternative to Straub and they're aware of it. Not saying this is Straub, but any contractor, you're at their mercy if you're not prepared to deal with it, which is why when I see statements about, oh, we've got an 8 to 10 week lead time on the equipment and the price is going to go up. Well, I'm not sure why they're pushing that to get us to do it faster.
So that was from the subs. That wasn't from
Okay.
Straub. They're passing what they were told.
Okay.
So when I talked to Chad, that's what he told me. He said, this is good for now, but they have all told me with expectation for costs going up.
Well, it's still in the line item below. It says the electrical work required for the above scope of work, 11,198.
Mhm.
I say the
They're
biggest
using
thing,
existing, I'm sorry to interrupt you, they're using existing electrical work with no new electrical work going in.
I don't believe they're not putting in new breakers and running full wires.
Okay.
But they are up on the roof having to run
Okay.
new wiring to the,
Units,
because the units,
right?
what he told us was they were going, every unit up there has emergency heat coils. And what he had originally told me was they were going to replace the heating coils that are in those units with bigger, beefier ones, change the brains and the RTUs and make it all work. Well, Train ultimately said, no, you can't do that. You have to have completely separate
Yes.
things but you will be able to wire them in to wherever the power is coming out from up there.
All right, well,
Well, the biggest thing I came out with when he and I were talking earlier is we pay above and beyond, and we still don't know if it actually works until summertime.
That's my point
Mhm.
too. That's what I was thinking.
That's why this sucks in so many different ways. We're paying more than we were anticipating, and we won't even know if it works for another 6 months.
So everything that's on here, I mean, it doesn't help totally, but it will be warranted for 12 months.
Okay.
I did get Brian Quissel to finally say, and he said it in there. He didn't guarantee it, but he said the strongest language I've heard from him. Do you remember what he said, Dan? It was something along the lines of he has no concerns about it working or something like that.
I ran it by a mechanical engineer, my father, who said it's overkill and it will definitely work in his opinion. So take that with a grain of salt for what it's worth.
So then why didn't we do this at the beginning? Like, why weren't they thinking like this ahead of time?
You want an answer from me?
Go for it.
I'll be on the record. I think it was an oversight in the engineering specs and they made assumptions about fresh air. Also, they figured the units were supposed to be running continuously and they do calculations about removal of humidity from that. However, the units were so efficient, they weren't running long enough to remove humidity. Thus, the humidity built up because the units weren't running typical. So it's like they over-engineered the units. Great, don't have to run as much, but they weren't able to remove the humidity. As a standard building would run, let's say during the summer, you're going to have the units running 50% of the time. And they can make assumptions when the unit is running, it's going to remove X amount of moisture from the air as it cycles through. But the units were so efficient and the building was tight enough that they are not having to run those. And so no one could anticipate that the units running less time was going to build up in humidity. You could say it's an oversight but
But even if that's true, don't tell me this has never happened to some other buildings, some other place ever.
it's not common. It's not common to have the units not running. You can't remove humidity if the units aren't running. So I think the proximate cause to everything was that the units would turn on, run, cool it down fast and shut down, which is ideal for efficiency, but it's not in the removal of humidity. So we're going to have to expense electrical power to heat the air to remove the humidity, and they're in line. And it's a very robust approach to fixing the problem. And I would say, I would put my reputation that I'm 90% sure this will be effective based on my research and getting input from other people.
Yeah, so I had asked him the question because I said, I said I was not aware that the alternative plan had fell through until I talked to Chad. And I said, the board will likely be surprised and want to discuss. And really what I wanted to know from him was, are you still confident that the work specified in the contractor proposal request will allow us to effectively reduce humidity levels throughout the building? Because I want to go through all this and have any chance that it's not going to work.
Mhm.
And what he said was, I'm very confident that this will solve the humidity issue in the building. That's probably the strongest. When he was here the last time, you asked him, I think, like 5 different ways, and he never would answer the question.
Mhm.
He never did, and it scared me to death that we were going to do all this and it's going to not be any change and we'd have to have this discussion again. Well, finally he said, yes, it should take care of it. And like your dad had said, yeah, it's way overkill.
It should adequately do it.
Okay, so what are we supposed to do about it?
I'm going to make a motion to approve this and get it going, not because I think it's the most efficient way to do it, and not because I definitely think we could get this done for less than 40. However, this is a employee comfort issue. It's a big deal. So unless we want to put this out and rebid it, I think the sooner we can get this going, and if they're looking 8 to 10 weeks, call it 12 weeks. They're gonna barely get this installed and executed by March. So because of that, I wouldn't want us to delay this issue in light of the fact that it's substantively adversely affecting employee morale and comfort at work. And only because of that, I'm gonna go out on a limb and make a motion to approve this bid, get this ball rolling.
A second,
Yeah, I'll second that.
any further discussion?
And we can discuss it, guys. I don't feel super strong.
I think we kind of have.
Okay.
I know,
Yeah, I
if
think
there's
I
anything else
will
to
say though, it's 6 months. I think she and I would probably agree they'll be held to pay if it doesn't work.
If there's a problem with this, this is gonna be,
Well,
I'll drive you.
I'll allay, let me give you guys, since we're still in the discussion, let me put this in context for you. By putting heating coils in the ductwork itself, essentially it's like going out and buying several large dehumidifiers and plugging them in and running them in different locations. So it's essentially a dehumidifier in line with the systems that are going to do the work that a dehumidifier does. They will be set on the humidistats to bring the humidity down to prescribed selected level. And so they will run until it gets down. It's like if we went out and bought 50 dehumidifiers and plugged them all in and set them to max. And then if it got too dry, we'd have to ease them up. And I actually think that whatever setting we put these on, it will run until it achieves that humidity.
Will the air conditioner still be doing its job too?
Air conditioner will be separately running.
Okay.
And let's say,
So if that shuts off.
if we set the humidistats at 30%, the AC units will run to cool it down. And if there's too little humidity, the dehumidifiers won't fire. There is a chance, but in the summer, there's not going to be a chance that we over dry it out. But if it does, we can adjust the humidistat. So the removal of humidity is separate from the cooling of the units that they apply.
Yeah.
So you can have a set temperature with the air conditioner. The humidity will be its own separate adjustment.
Correct.
So even if the air conditioner turns off because it's 70 degrees or
Correct.
whatever, the humidifier will still be doing its thing. Dehumidifier.
It will.
Could be.
And it will take quite a bit of load because as the dehumidifier runs, it actually applies heat into the system, which means we have to run the AC unit's going to run a little bit more to balance that. But the net utilization of electrical power would be the same as if the units were running and pulling humidity out of the system. At the end of the day, it will set the humidity in this building so the employees aren't having issues.
I just don't want the air conditioner to keep running at 60 degrees and low humidity.
Yeah.
That doesn't do any good. Everybody freezing to death.
No.
Yeah, so,
Like two separate.
well, and that was the problem, is
Right.
we were really cold and really wet.
it was damp and cold.
And so once we had bought 6 of the standalone dehumidifiers, and I mentioned that after everyone settled on what the solution was. And they actually worked really well. So each of these units are actually, 10 of those is going to work amazing.
Okay, so we have a motion, we have a second, we already did discussion, ready to vote? Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
Okay, moving on, next one.
All right, the next thing is my report. We already talked about slope. We are working with the sign company to get that signage out on at the corner of 110th and Ambassador. So it'll be a monument sign, and you can't really see it from here, but down at the bottom, it'll say primary care services provided by Slope Health.
Okay.
We actually hired a sign company to help us come up with the specs, to make sure that when we put it out for bid, we get a legitimate sign. It will include all the electrical to light it up, and we're going to put in the bid lighting up the signs on the exterior of the building too. but we want the electrical to be, and the signage all to be together.
And it can be changed out if Soap decides to move on and we have to bring somebody else in. We can switch out that part of the sign.
Yeah. Cause it'll be probably pinned on there and we'll be able to take it off, paint it if we need it, put the new letters on.
Not that I want to, I'm just saying if it comes that way. And then Air World's cool with it, they have no complaints.
That's what they've told us so far.
Okay.
It has to go to I always want to call it
The
HOA, but it's the Air World Owners Association or whatever they actually call it. We have to do an application. We've been told multiple times we could not have a electronic sign like I really wanted, but they said a sign like this would be fine, and I think they told you that, they told me that, they told Aaron, our PIO, that, so we should be good. But until we have a piece of paper that says approved, you just never know. So next thing on my report, I think we've covered the HVAC stuff. On our budget right now for revenue.
The water leak, is that what you're next, or we just jump past it?
I do have something about Dan, good job. So Jansen Glass has been out, and I know you all may remember we did a field trip one night and we went and looked at where the water was coming in. The glass is now up. Looks pretty nice from the outside, matches the same it's paint around the windows, but it matches the bronze color. It's a little bit different than what is back here that we looked at, but it is what we were expecting. Got that little sliver of glass above the door. They had the wrong size the first day, so he had what looked like bubble gum packets holding it in, but that has been fixed. And the door only locked if you held your tongue right, you put your foot on red and lift it up, and it was some weird thing. He's like, all you have to do is this, this, and this. And I'm like, you're gonna fix that, right? And it was the worst part of the conversation because he's like, well, I guess you could call the office and have it fixed if you wanted.
Oh,
Like, yeah, I think we're gonna have that fixed. And Dan was like, I think he was at a meeting or something that day, and he's like, they said what?
Yeah.
So Dan roughed him up a little bit.
Good
It
job.
was within a week they had it fixed, though. I was impressed.
So we had the massive storms, how'd it look?
Yeah, I was gonna say.
Great. No
issues?
water in there.
Nothing?
Okay.
They hadn't been paid, right? In
No.
full yet? Okay.
No.
And we just,
That's why they did it. They want their money.
We don't
The
like to
check
pay
today.
till we're happy.
Absolutely. I'm glad to see a governmental agency doing so.
Yeah. I mean, they kind of started out funny because they didn't know where to go when the two guys showed up. And well, it's not the same size. You're not removing, you're adding. And then that's why it's not the same size. But it's all in. It looks good. Smells terrible in that little place because of the adhesive they use, but other than that, good to go. Budget overview. End of October is 83.3% of the year.
Damn.
For our revenue, we are 88.9%, or $3,858,071. And for expenditures, we are at 75.4% of our budgeted expenditures, or $3,272,480.
Are we gonna be short than what we were expecting for expenditures then? It's October, so November, December, so we have 2 months to
So-
make up to the 25%?
It's kind of, well, I won't let Dan just spend extra so we can spend it all.
Right.
That's what he always wants to, actually, it's exactly the opposite. he won't let me. We do have some things that are just due at the end of the year.
Mm.
So, we pay for certain things for the entire year. A lot of times at the beginning or the middle of the year, we do have a couple bills that are at the end of the year. We will come in under budget.
Plus, we don't have 2 months worth, 3 months worth of clinic operational
That's
expense.
Right. And we are going to try to make sure, well, we may not be able to do it. I would have loved to have paid for like the HVAC stuff out of this year's budget instead of next year's, so.
Just make sure you put that in your little spiel or whatever that we were below budget. That's bragging points right there.
So we are, and it's on the new business, but it's on my report too, so I'll go ahead and talk about it a little bit. One of the things that we have on new business, if that's okay, Mr. Chair,
Go for it.
is the first draft of the FY 2025 budget.
What page
I
are we
think,
on?
it's on page 54. Well, yeah, 54 is where I have some anticipated additions. So things like the payroll scale adjustment that approved, the public health, environmental public health specialist and health educator position, strategic planning consultant that we'll talk about later, managed services we'll talk about later. But the issue with the budget is, and Dr. Chaffee mentioned it, we didn't have some of the family health care expenses. The problem is we're still paying for some of those things, so we don't know exactly how to project. Things weren't like, this is this and this is this. They're all intertwined. So we do not have a budget to present this month or this month's meeting. What we will do is, Susan, if you're okay with it, we are going to have a special finance committee meeting to look over it. I believe not next week, the following week, and then we will email everyone the budget.
Date and time?
December 6th.
December 6th?
I thought you said 4th.
Oh, whatever the Wednesday.
So
is.
Wednesday, December 4th.
Yes, Wednesday.
What time?
Whatever works for.
Yeah, I'm gonna let
Susan.
her know
She's
tomorrow.
gonna let me know.
All right, just text me.
And we'll send you an appointment.
Okay, that's fine.
But I think the big thing is we really have to tease out what we're not paying over there. So the budget numbers work. And because leaving in like a whole nother program does not work.
So looking at this then, so you say required, and then optional. What are the criteria that you with the optional things? What is it that?
So required is the board already made these
Yeah.
motions and
So
approved.
so what is the optional? What do
We
we?
haven't discussed them. We've discussed them in finance meeting, but not here yet.
Okay, so that's
We haven't
there.
presented them.
Okay, I won't jump the gun. Then.
So they're only optional and that I'm going to ask for them, but you
Right.
all can discuss, and if you decide no, then we're not doing it.
Right, and then also the environmental public health specialist, health educator positions we approved,
Yes.
but there might be other positions in the future that we'll have to discuss as well.
Probably not next year for sure.
Okay.
Because, I mean, we're going to have cost savings.
Right.
But I'm not sure, we're pretty confident that these positions are great, but I don't want to overextend anything, and we're trying to also keep that schedule of paying up our lease purchase obligation. We're wanting to put money into our reserve
Speak in my
account.
language.
We have a lot of things that we're trying to do.
Right.
And we don't want to overextend.
So I think, so when they said what, 19 positions or something is what was recommended by the accreditation people?
14 ones.
14. If you could find out why they said that they thought we needed those things, and what's the priority list on whether we needed them or not needed them? I think if you could get that out of them.
At the foundational public health services, and they're saying to reach all of the foundational public health services, which is that model. I think that we've put it in here before. But I think that they're just trying to estimate how much each entity needs. And then I think ultimately they want to use that to go to the state and ask for more funding.
Right.
So, I mean, like, it's also like, it depends on the environment and what's going on in each county. So I think that it depends. So, and then we just hired, so really it's 2 less. So really it would only be 12 because we just hired those 2 new positions.
And it's kind of pie in the sky, best
Right.
case scenario.
Yeah, I've already talked
And
about
we
it.
had, you know, like if you were a fire or police department, what is your optimum staff?
Right.
What is the best thing you could have? That's what that is.
Right.
It's not real.
That's what I'm saying. What is the priority? Like when they say if we need 12, like why do they say we need 12 and what is the real priority that we, because we're doing just fine with what we have, except we just hired 2 new people.
Well,
But
we're doing pretty good.
yeah,
But I think as we go through accreditation and find these gaps and we really start doing continuous quality improvement and really monitoring what, you know, more than just the wing flaps of what we have done,
Mhm.
but seeing where we need to move the needle in the community on certain things, I think we'll have a better idea where we need to place those positions.
Right.
I said it in my memo and I probably wasn't super eloquent, but those 2 positions, we just know we were short on being able to provide those inspections. Having any depth at all was a real problem, and health education was a similar issue. So we knew those. I can't tell you for sure where other positions would be. I would be thinking probably in one of those 2 areas or in our communicable disease section, but I don't know, and I'm not gonna guess.
I just want to be efficient, and I believe less is more sometimes. Adding more bureaucracy doesn't always necessarily fix things. That's why I said if you can give why they said they said that, and then the priority, that helps us decide if that's something we're interested in moving forward with.
And I think I had
Go
a
ahead.
conversation offline about this as well, that I think if you look at other health departments, how could you figure out an optimal staffing? Well, you look at an average, that if we are more efficient and we have less sick people.
Right.
My biggest question was, are we going to have any hiccups with accreditation if we don't meet what they have deemed as optimal?
That's why I want to know the priority.
Well, and again, it's one of those situations, garbage in, garbage out. What is their criteria to create this denominator from data from all around the place? And as long as we have an adequate CQI, my question only was, if we're 2 positions short from what they deem optimal, is that going to cause us not to receive accreditation? I think the answer I got was no.
So,
Yeah, so
okay.
that's not gonna affect accreditation
Okay,
at all.
excellent.
I mean, sure, I'd love to have 12 new employees under me to help me with accreditation, but I know that that's not gonna happen.
Right, right.
But I think, I mean, there's certain areas, and I mean, I can pull it up, but I mean, they're like Andrew said, it's kind of like the ideal world, like we would have more people. So I mean, I think it's something to think about for the future, but probably not like right now.
Okay. So you're talking about this is like a year or 2 down the road that we even have to discuss this. Hopefully.
It's going to be at least a year.
Okay.
So, and one of the other things we'll talk about, one of my goals is to have everything we need for accreditation turned in, the whole package, to be judged for accreditation, whether we're ready or not, basically a year from now. So December 1st of 2025, we will have sent some big package electronically to the Public Health Accreditation Board that says, here's everything about the Platte County Health Department. Here's how we do things. Here's every one of our policy and procedures. Here's how we provide the foundational public health services. Here's our metrics that we're going to be looking at. Here's what our needs are in the community. This is how we're going to react to those. Here's our strategic vision for the health department. Here's how all our stakeholders intermingle with us. You know, all these things. And we talked about, you know, some new stakeholders like the Platte County Children's Fund and different things.
Right.
But that whole package is getting delivered in a year. After we start working on that packet, I mean, I doubt before that time we're going to know much more about positions. after we work on that package and trying to meet all those goals for a year or two, then we may have a better idea of where we're not pulling the cart up the hill, right? If that makes sense.
Okay. All right, so the rest of these optional things we're gonna talk about in their finance subcommittee, so I won't. be
Yeah,
at-
or they're going to be on
It'll
the
be coming
agenda.
up. Okay.
Yeah, that's fine.
Some of it will just be in the budget.
Yeah.
And that's my report. Dan, you're up.
Right. Probably the most important news I have to report is that we have hired Rachel Simpson as an environmental public health specialist, so we're fully staffed in environmental health. And Abby Hunt was hired as a community health educator, so we're fully staffed in that division as well. And Bailey Moore is the supervisor of the environmental health division. She has slowly begun to release both Rachel and Kyle Bledsoe into the wild to do inspections.
So yesterday was their first inspection alone without her.
Yeah,
Rachel has a lot of experience with on-site wastewater or septic systems, but no experience on food, the way I understand it. So and Kyle didn't have any inspection experience. So she sent the two of them out together to do their first food inspection alone without her.
Yeah.
And they came back, I saw them both alive,
yeah,
so.
it's fine. Yeah, it's all
So
good.
did Bailey then go after her and just make sure everything was done, or what did she do?
She would have reviewed everything, and looked at their pictures they took, but no, she wouldn't have went back out.
Okay,
She would have made sure they checked everything, had all the blocks filled in. Some of it is required things, from the software, but yeah, she would not have gone back out on this one. I'm sure in the future she'll have quality checks, which will be going back out, but it'll be more random.
And I've been spending a lot of time with them in the sewage program, which is
Not in the sewage.
not in the sewage, as much as possible, but it's actually my favorite program. I don't know why, it's just weird. But we actually, this past month, I say we approved the subdivision, actually, the Department of Natural Resources approved the subdivision. We kind of, after they approved the subdivision, for us, it's pretty much a rubber stamp, but it's a 17 lot subdivision, which is one of the larger subdivisions we've approved in years, that have on-site wastewater treatment systems. All of the lots are over 3 acres. I think you're familiar with.
is that the one that we talked about?
Yeah.
Yeah, okay.
Yeah. So.
Everybody's happy?
It's right off
Where's-
45.
Where is this?
I'm sorry.
Where is it? Everybody's happy if they want to where it
Yeah,
is.
yeah, it's right off 45 highway. It's kind of between the National and, well, almost directly across the street from it. But it's kind of back, it's a private road, but 17 lots that are all good size, so it'd be very large homes, I'm sure.
Is it on
Yeah,
the
it's
north
west of
side or
the
is it by
National.
River Hills?
West of the National.
West of the National, okay. All
Yeah,
right.
if you're driving down 45,
Okay.
you see all the,
Oh, yeah.
Is that north side or south side of Fort Pond?
all the dirt. It's on the south side.
South side.
South side?
I drive by that area all the time.
Yeah.
So everybody was happy, so we're all good?
Yeah,
Okay.
There's a little frustration, I think, was moving a little slow.
Right.
In getting their approvals and, once there's 7 lots in a subdivision, it goes to DNR instead of getting approved locally, 7 or more. So, we didn't really have any power to speed things up other than to call DNR and say, hey, what's going on?
That's fine. Anything that could expedite it is a good thing.
Yeah.
Well, and sometimes just us making that call.
Yeah.
It really shouldn't have any impact, but it does. Right.
That's good.
I keep saying this, I want us to be as business friendly as possible. I want people to want to come to Platte County, do whatever. I don't want to hold things back.
Right.
We do it the right way.
Yeah.
But I don't want to slow things down. I want them to be happy. So that's
Yeah,
good. All right.
That's been a real point of emphasis with the inspectors with on-site wastewater treatment systems. When those installers put those systems in, we can't make them wait. We've got to get out there and get them inspected so that they can move on to the next job, because time is money. Their equipment's sitting there waiting for us, that we're failing. So,
Right.
And, with the addition of a person, it doesn't seem like we've added a lot of depth. but every single one of them, now all three of them, will be able to, run out and do that inspection, so no one's going to have to wait for 2 days, and we did have, I don't think Dan always knew, he's found out some things that were a little concerning, but I think we remedied that.
Yeah, I rarely, I'd say, get a call from, a particular installer who I have a lot of respect for. And, in some cases, I would just go and do the inspection, and, in other cases, if I couldn't get out there, we, do the best we could, but, we just have to make sure that they do not wait on us.
Right. Because they have equipment, they have people waiting, and, they can't finish their work till we look at it.
Yeah,
It is critical.
and the really good installers, really, they want the inspections. I mean, because what ends up happening is the bad installers get tired of messing with us, so they just kind of work elsewhere. The good ones, they want some reassurance, but to be able to give the homeowner assurance that, yeah, not only am I telling you this is a good system, but so is the inspector. So it's a pretty good relationship with most installers. But yeah.
Contractors I talked to, they said Platte County is great for getting business permits, contract permits, and hopefully they'll start saying that from the health department. We're really
I hope they haven't said otherwise.
honestly, I want the word of mouth to get out there
Yeah,
so people
yeah.
want to come here and do stuff.
Yeah, that's
As
very important.
far as I know, they always have said that on the septic side.
Yeah.
We just had a couple things recently that we were like, yeah, we should never. It's just the whole customer service mentality, just kind of re-stressing that for everyone.
Yeah. Okay.
We did have a harvesters event in November earlier this month. Harvesters didn't show up.
They didn't show up?
Did not show
Is that
up.
the day I showed up to talk to you?
Mhm.
So we
You
had it
showed
all
up.
set up and they didn't come.
Yeah, you showed up. They did.
Oh my gosh.
And then Tia, Biggest, who works for Trisha and Health Ed, came and tried to explain it to me, and I'm like, my thing was, did we screw up? Was there something that we did? And she's telling me the story, and I'm like, I just kind of need you to cut to the end. Was there anything we could have done? And turns out, no, Trisha had called. She had the receipt showing that they were supposed to be here. It kept being a switch on the harvester side on their software. And I'm like, well, it kind of stinks, but we do have a pretty small food pantry that occasionally we get people in that we give food to. It's largely all donations. It's not money that the health department has spent. Janice, our nurse practitioner that works here, is it her daughter or son? Daughter's ball team every year has a big food drive, and that's largely how we fill that pantry up. So everyone got something. It was very weird that they didn't get their vegetables and potatoes and carrots that they normally got, but they may have got some cake mix and some canned greens. I don't know what all they gave them, but they did give them something.
Yeah.
So did we refer them to some other place that did have the harvest?
We did.
Yeah, unfortunately, we have a pretty generous community in Platte County and a lot of food pantries that, and food pantries aren't intended to fully feed a family. They're just a supplement. So,
Right.
but yeah, there are a lot of options available, and we'll do everything we can to make sure that that doesn't happen again.
I drive by a large one every Saturday morning on the way to the gym.
Yeah.
The Gloria Day Lutheran Church has a
Mhm.
big
I was
line
about to
outside.
mention that one.
They are very busy there. It's out on the 72nd.
Right.
They're going, so.
We have a referral list we provide to folks,
I know
to a lot of the
Tricia does.
community-based organizations like the churches, different
Yeah,
churches.
yeah, I know Tricia does. I can't put my hand on the list right now, but.
So, no, I'm just, as long as we keep a list of all the community-based organizations that provide those services, that when we try to maybe have somebody make sure it's updated periodically.
Right.
Are we planning on doing this every month, even during the winter?
We do, yes. And
You got something?
so there is a list that Tricia puts together, but then we also refer people to, most everyone has a phone. Even if they don't have a lot of money, they still have a phone. So 211 has a real comprehensive list, and then findhelp.org
Okay.
has, and Dustin and I were actually talking about this, yesterday?
Mhm.
Just some of those resource lists, because it came up, like, we need to come up with a resource list. Well, the problem with those is not ever creating a resource list, because you can do that fairly
Keeping it
quickly. It's
updated.
keeping it up to date.
Yeah.
And, really like Find Help or 211 is better to refer people to, because in theory, there's mechanisms to keep those up to date. Sorry, Dan.
Oh, you skipped the thing about going to Macon.
Oh, yeah. So,
And how Dan just talked the entire car drive. Wouldn't give Dr. Chape a moment to say anything.
Really?
No one believes that.
yeah. But yes, Dr. Chaffee, Andrew Taylor, and I participated in a roundtable discussion with the Senate Majority Leader in Missouri. Actually organized it, and I believe, I want to say 11 of the local health departments in the northeast part of the state were represented at the meeting, and they just discussed some of their concerns. They have big transportation challenges. I met that people with Medicaid, Medicare, getting to doctor's appointments, it's a serious problem up there. And I believe the transportation is dispatched out of St. Louis, so sometimes they just don't show up. They don't. No, I'm not saying that has anything to do with St. Louis. It's just a long way from St. Louis to many of those communities. So they have a lot of no-shows with transportation, and people being left at doctor's offices are not picked up at all. And so it's a serious problem.
So a complaint came up about the Oaks Transit, which is, I'm on their board. And so I actually contacted my folks there, and they said, well, the problem is Oaks isn't running it. So they're just a subcontractor for the people that run it. So if they don't get the order, they're not going to show up because they won't get paid. So they are aware of the problems, but they're at a different level. I do want to give Dr. Chape a chance to talk about that meeting, if you would. I thought it was really I didn't know what to expect, but I thought it was a way better environment and discussion than I'd anticipated. And I thought it was pretty impactful to the senator.
She is president of the Senate and will likely be taking a more leadership role in the administration of the new governor on the healthcare side. We were able to meet with 7 or 8 different health departments, from very, very small to us. I got to get a sense of how good we really have. They were shocked that a board member would come out to help them. And what shocked me was that their board members weren't willing to do what we do all the time.
Did they go to the meeting?
I was the only board member there.
Great sakes.
No, that's okay. Senator Laughlin had personal knowledge of all these different health departments, and some were positive and some were not as positive, but her interactions with people who had not been positive in the past seemed to fall to the wayside, because everybody saw we were actually very interested in collaborating, brainstorming, and trying to come together to improve statewide. My sense is that Senator Laughlin sees there is a role to engage, and my suggestion directly to her was engage DHSS to have it be the distributor of funds if necessary, and coordinate with a potential Missouri Association of Local Boards of Health that would provide a sounding board, feedback and communication with other board members so that we can share and everybody could share sort of what is important. I got the sense that some of the board members would automatically veto any increase in their levy. I gave them the suggestion to make sure they break down exactly what they're getting for their levy. And if they're going to go to the board members, they need to bring the board members something to tell the community why the taxes went up. So we had a good experience. We now have a good contact at the increased in contacts at the state capitol with someone who has some clout. Senator Laughlin was very affable, down to earth, just straightforward. She didn't try to put lipstick on a pig. She called a pig, and when something wasn't right, she addressed it directly. That you get me this, we need to fix that. Small problems were brought up. They might have seemed minuscule, mamby-pamby, like oats not picking people up. She engaged on it, and it impressed me because she did so not because it was politically expedient, but because it was the right thing to do. And that's the sense that I want to give everybody here, that it was a very positive meeting, that we can get a lot better health department integration and synergy in the state than we had before. I think this was the first step towards it.
Where is she from? I mean, what,
Macon,
the what?
From there?
Macon area.
That's her hometown. Where
Okay.
is Macon's her hometown, or where is it?
The whole northeastern part of Missouri is her,
Is her
Area.
her district?
she is the majority or the senator. So
she is a businesswoman. She is amongst a family of farmers. She understands how to operate a business efficiently, effectively, to look at root cause, address it, and don't get emotional about it. It is what it is. What are we going to do to fix it? How are we going to make sure our fix is good? That's sort of a no nonsense approach to dealing with issues.
And she was the general manager, or whatever they call it, for the Northeast Oaks District at one point. So and I was.
Well, she was on the board, I think.
Well, she was,
Yeah.
she worked for them
Oh,
for a
yeah.
while
Oh, okay.
and ran that section. So she has personal knowledge, and everyone that I talked to, I didn't know her from that way, but they all knew her. And so it was interesting. But I really thought, thank you so much for spending your day with us. I thought it was really great to show up. The only negative thing I'd say is they picked the loudest restaurant in the world to set us next to the kitchen. But we got over that, and it was a really positive meeting. And on several of the Lois, who is her assistant, has sent us multiple emails back and forth, and at multiple meetings, not just those folks, but other people have said great things about the health department and us going and doing that.
I did have a brief discussion with her that I felt that there was a role for some entity to try to set an example for health departments to try to encourage board members to have the backs and support of the people implementing the policies and the care. And that it seemed as though that it was more of an oversight board that just griped and moaned, and they felt they didn't have support and encouragement, sort of the antithesis of what I sense this board is doing.
If you had 11 health departments there and no board members except you, that shows that I think we need to engage other board members across the state, and we need to facilitate with them, and we need to be mentoring and give them
There is
the
a role
opportunities
for
to
that.
be involved. But if they're not going to get involved, that just kind of shuts down all the whole process of what we're trying to do.
I think it's going to take some funding initially to get startup capital going to try to help create a situation or an entity, possibly officing with DHSS and with is it Tiffany, and have Tiffany try to help encourage boards and to work closer and be more supportive. And I did tell the senator I would be more than happy to plan to go out and help make visits and
Right.
also meet with boards and things like that to see if there is a role to create an entity like a Missouri Association of Local Boards of Health for trustees.
So one of the things you mentioned was just getting everyone together and to create this synergy where we're feeding off each other and working together. Well, during that meeting, Taylor had mentioned something to Sharon Wisenand, and I forget exactly what they were talking about. It was in the meeting. You may have it in your notes, but
Yeah.
she said, hey, we'll meet. Well, that meeting actually happened today. And so they did a Teams meeting, and afterwards, Sharon responded to me and said, you're awesome, but Taylor's awful. No.
Yeah.
What she said was, Andrew, or good afternoon, Andrew, you have some amazing staff, exclamation point. I just had the opportunity to meet with your health educators and quality improvement staff today. It was such a productive and inspiring discussion. I truly appreciated the chance to exchange ideas, learn more about what's working well in your community, and share what we are doing in our community. I left the conversation with several ideas and am eager to explore those further. I look forward to continuing to connect and support each other and the important work we're doing. Have a great evening, Sharon. And then we said a couple things back and forth. But, you know, that probably wouldn't have happened if we weren't all at that meeting. So I did think, you know, just some of those connections, you know, during the meeting, it kind of came up, oh, Platte County's so different. They're on the other side of the state. They're all really rich, big population. There's no commonality. And I think even during the course of the meeting, we realized there was more commonality than what you might think. And I'd say, I don't know if you have a comment about that meeting today, but she was very impressed.
Good, yeah, so we
So
met
good
with
job
her.
to the health educators.
Okay. Yeah, I mean, so I think that it was a good opportunity for us to share some ideas of things that are being done here. And then she also shared some ideas of the things that they do and shared some of the grants that they're working on. So she shared some information on some potential grants that are related to health education that we might be able to apply for in the future. But yeah, it was really good conversation with her and it was great. Great to connect.
What's the county of our counterparts that were at the meeting in Columbia, down by Springfield? Where are they from here? Webster County. I was gonna say Crawford County, but Webster. That's a small county and those guys are all engaged. So just because we're bigger, we have a bigger fund, whatever, doesn't mean that you can have a smaller group do the similar stuff that we're
Different
doing.
leadership.
It's leadership and it's buy-in engagement of everybody, not just one of the
Because
people.
their board's very active, as you
Yeah.
guys know, you met several of them.
Right.
Their director is new, and I think in his previous life did a lot of EMS kind of stuff.
Right.
And just that's how he runs his shop. And so I think it is leadership. And I think I may have mentioned, you know, during the past 5 years, about 50% of the directors across the state have switched. You know, they've left,
Right.
retired, whatever. And I think there's whole lots of opportunity to engage and provide leadership and a good example and mentorship and collaboration.
Some of the issues were similar between the different counties, and some were completely different, which showed that certain counties have substantial needs, even to the point, and I'll share this because when I take notes, I try to write this important stuff. And to me, this was important. Even the waitress chimed in midway, discussing about how that some of the inmates would come to their restaurant from the health department or something along those lines. And so there was that was the level of infectious enthusiasm that was ongoing because yes, it was initially people vented, not griped, they vented about their challenges to get feedback from other folks. And there were some commonalities and it was eye-opening, I believe, for Senator Laughlin to see, oh, there's dysfunction that these issues aren't getting the support they need for these folks to adequately address stuff. I hope that's fair. Let me know if I'm,
Yeah, I think she was really impressed with I think sometimes people hear the word health department, they think, regular, you forget there's people involved. And all their stories, or most of them, really brought the level of, no, these are really people in our community that we're serving. There's real struggles, and this is how we're trying to meet that need, and we don't have the resources.
and I can go through everything, but everything from Schuyler County, which is so small, they actually have no grocery stores, that they have staffing and salary issues, and they can't get their board to increase their levy to meet the needs of the county. This was a common theme, but when I would give them ideas of how to address that, it was good because they were getting some outside the box ideas, not necessarily the right ones or the wrong ideas, but outside the box. I think we were able to establish, I think there's a role for it, for somebody to alpha and take the lead to try to help create this coordination. And I told Senator Loft on a personal note, I said, I'll be happy to get my shoulders behind anything that people can use help with.
Well, again, I know it's a huge commitment and I appreciate it. And it was fun. I mean, we had good conversations on the way there and on the way back and during. So it was kind of
you talk about things that they share, all the small counties maybe share with the larger ones, but transportation is a huge problem. And I'll tell you, it's across the board. It doesn't matter if it's a small county, a large city, it still is a problem. I deal with that every day, trying to get patients to where they need to in my job. And that is the biggest barrier to getting things accomplished for me. So
transportation is one of the three things that we're addressing in the community health improvement plan. I don't know if it'll make it on the next version, but on the current one it is. And yes, Kim, that's what we're hearing here too.
I just want to piggyback and kind of what you were saying. The meeting that Susan and I went to in Columbia, we had one of the, I don't know if she was the director or whatever, the one that was crying because she couldn't believe how good we had it and how horrible her county was, the situation.
He was very.
The Secretary of Health and Senior Services was actually sitting right there with us. So we even have from the executive level seeing the exact same thing that you guys are seeing from the state, but the Congress or the Senate level or whatever you want to call it. So I think we could get buy-in from both the Congress and the legislature and the executive.
So Paula Nicholson is who you're talking about.
Exactly.
I assume.
Yeah.
And I think there's room to grow between the legislature and what the health department, what Paul is trying to do.
Right.
Because I think sometimes when they discuss stuff, they discuss it. Senator O'Loughlin during the meeting said, "Oh, it's good to hear that you guys like this part of what she's doing." But then, one of the big things was the state used to have much more of a presence out in the communities and provided more leadership and mentorship to these health departments with little resources. And now it's so much more of a customer client kind of thing. They'll have a contract. They say, go, we'll give you money if you do it, but very little assistance except you didn't do it right. And that is very frustrating when you are trying to serve, even 12,000 people, but it's just 2 of you.
These are counties they're struggling to get people to the doctor for serious issues, let alone being told by somebody as well-intended as Tiffany, is it Bear?
Mm-hmm.
As Tiffany Bear, you ought to try to go through accreditation. These folks thought we can't even get that. But they didn't, also they said we don't have the funding. They didn't realize that you can get funding to go through the accreditation process, that there are sources. So that kind of collaboration, I think bodes well for us trying to help encourage this at a statewide level. And it's going to help us get ideas from them, but it also gives perspective that I think Platte County Health Department is, I'm very proud to be part of this. Let's leave it that.
The lady that was crying, remember, she was the clinic nurse and the director or whatever she
Oh,
was. She didn't know how to do any of the grant stuff that you're talking. She
Well,
didn't
she could barely keep up,
Yeah.
just taking care of the patients that came.
know. So she didn't even know how to even get the money if there was money available. So there has to be guidance from all different levels at this process.
Well, and when I met with Senator O'Loughlin here briefly, we had a meeting before that meeting, and I pretty much told her, I said, there needs to be information sharing. Board members need to be aware of what the struggles, and they need to get behind their departments. But at resources, availability, how other people are doing things, that collaboration needs to go on, because that will absolutely enhance all the other health departments in the state of Missouri. And it will all come back to us. I call it the boomerang effect, that by helping other people, we're going to learn about ourselves. And
But I think that advocacy
Yeah.
that both you are talking about, the board clearly is not behind this nurse that was crying, this director that was crying.
Yeah, she was.
But there's others in the state that are in those same positions that are saying this should never be happening. You should be creating would you want to work in that environment? You know, she can't say those things. You
Right.
can say whatever you want to them. And I think it's one of those things that sometimes people need someone to back them up. And I love that this is an area that you guys are wanting.
Okay, I promise I wouldn't talk a lot, so let's move on to the next thing. Sorry. Otherwise, we're gonna be here till midnight.
or not, or you guys might.
So my report's not as exciting as Dan's, so hopefully it'll be pretty brief. Our biggest thing is, it's flu and COVID months, so we're doing a lot of those offsite clinics, drive-through flu clinics, preparing for a lot of those. We'd have Julie Calvert did retire earlier in the month of October, as well as Cassie decided to have her baby very early in October. So that made it even more fun for us to get through the season.
Yeah.
But we somehow are pulling through and getting through it. We also had SWOP come in and start their services there, we spoke about earlier, and all that's going very, very smoothly. I do want to give a huge shout out to the nurses for stepping up and kind of helping cover some of like the clinic shortages we have right now, as well as this isn't in my report because we just had this visit yesterday, but our VSC coordinator was here for our annual inspection, and they always love coming here because we're like the gold standard. They like to share everyone to come to and
Say what that means.
Vaccines for Children, thank you, sorry, program. So she came out here to discuss all that. And one of the things she wanted to highlight, they're trying to show people more this year because they've had issues at other clinic sites, is vaccine wastage, where people are ordering too much or not enough and various things like that. Their state goal is like a 1% is where they want you to be at or under. We were at 0.3%. So we're doing a pretty good job at making sure we're not pulling out the wrong vaccine or ordering too much or having to return vaccine at all. So
It's the STI, we did the changes in the pricing and stuff to freeze. How's that turning out?
pretty well. We definitely, I feel like we're doing a lot more
So we
turnout
get-
for that. And
so
we
more
also
people
feel
showing
like
up.
and not only that, but they're getting more different types of tests too. Like herpes was one people didn't always usually get, or they'd get one or the other, but if this is all free, well, why not? We have full checkup right now. So it seems to be going pretty well with that. So I'm looking forward to see how it is 6 months and then see what kind of adjustments we have, seeing where our STI levels go, and make it be pretty interesting to see.
I'll chime in a little bit about Jackson County. They were having such difficulties with STIs. They funded a grant to University Health, which used to be Truman, and the emergency department got that grant to go out and do health fairs, 4-hour health fairs once or twice a month at different locations where they pay money to the people to show up to get educated on STIs. And then they get more money if they get tested. If they come up with something positive, they get paid to show up at the hospital to get treated at no cost, plus they get paid. The results of which are being tracked, and I'm privy to some of those spreadsheets. They had a big problem, and they knew they had a problem. They didn't realize the scope of how severe it was. And I think there's going to be a good research paper get published out of this, that while you think your surveillance is adequate, if you aren't going above and beyond further to do things like this, you're not gonna get a real good picture of what's going on behind the scenes. It was quite impressive.
Yeah,
To see all of this go on. So I share that with you guys that we have it pretty good again.
But surveillance is interesting. If you don't go looking for the disease, you don't have it.
Well, they have a higher incidence of a lot of STDs, and I think it's mycoplasma genitalium is the number one STD that they're finding there. And it needs to get treated because it does have some adverse effects. So I thought I'd share that little personal tidbit with everybody that we've got it pretty good. And you can talk about STI surveillance, you know.
How long have they been doing the program? You know,
Less than a year. My wife got shift reductions to go out. You know, she was at 12 shifts plus some other duties, but she got reduced to 10 shifts as long as she goes and participates in these. So she's enjoyed it, but it's a lot of work. They're some of these they're getting overwhelmed and they're running out of money to give people. So
HPV still should be number one.
you'd think.
Yeah, so HPV is still number one, but that's probably,
Let's see what, well, you know, it may or may not be, but in that demographic of the people who are coming to that, and there may be selection bias, it may not be representative necessarily of the entire county. But for those who are going to come and get paid to show up, I think it says the folks that need the money have a higher incidence, or here's the distribution in this demographic. If they don't write a paper on it, I'm going to steal their data. I can write it up.
Well, and we're doing free.
Yeah, that's
Yeah.
what
Oh,
I'm saying.
yes, yeah.
So like it's definitely, we're not having like everyone coming in on Fridays now. It's definitely dispersed throughout the week, so it makes it a lot easier for us to kind of keep track of that. So yeah, I'm really interested to see where it all goes, and they're all very grateful and excited that we have that now, and then it's going to go very, very well in the future. They all also been doing with health educators going out to all the daycares every Monday and Friday and doing their immunization audits, making sure that they're all compliant to be able to go there and attend. I think we have 3 more left. I think we finished in the first week of December. And we'll have that done for the year as part of the MCH contract, the Mother Children's Health contract grant. But it's pretty much the bulk of what we've been working on. We had a TV class as well, and we got to host it here because everyone loves our facility because it is nice, new and shiny. We have great technology. So always have to shout out to the board and everyone for making this happen, and people like being here. So do you want to have any other questions?
Taylor.
All right, well, by the time it gets to me, everybody's talked about all the things I wanted to talk about. Andrew kind of stole my thunder, but tomorrow we're planning on pulling the trigger for the registration. So then we'll have 1 year from that date to turn in all of our documentation. So in order to do that, all I need is a signature from you, sir. I don't know if you had a chance to read through this letter, or if you wanted to.
so how does this work though? So when you give them this big packet, they've pretty much been following us all along, that it's not gonna be a big surprise that come December of next year, they go, oh, sorry, you didn't pass. Like, it won't be, it's like, we'll know we're gonna pass.
So, and Taylor she is so particular and so OCD on these requirements.
Right.
She already knows everyone at FAB by first name.
Yeah,
And I
that's
think
nice.
we must call them at like 5 times a day. But she's like the perfect person for this job too. There's going to be no surprises. We will know long.
It'll be more of a formality instead of that this is still a gamble. Are we gonna get it?
Yeah,
Well-
I mean, I guess the thing is like, there might be some things that they say, this doesn't quite meet the measure exactly, so they'll give us 45 days after. So basically, once we turn it in, they'll take about 6 to 9 months to review all the stuff that we've turned in. And then they'll give us feedback, and they'll say, some of these like don't quite meet the measure, and they'll give us time to like redo those. And then they'll come out for a site visit, they'll meet with us, they'll meet with the staff here, possibly you guys. And then we'll be able to, I mean, they'll give us more time. Like, and my understanding is that they want you to become accredited. So like, as long as you're not like not doing any of the things. But I mean, I think most of the time it's like, okay, if we just misinterpreted this and we put a different example that didn't quite fit the exact example that they wanted, they'll just give us the opportunity to use something else. Or create something
But
else.
they're
So they
giving us
will give
feedback in real time.
Yeah, so it will be back and forth.
Yeah.
Well, so
They're not?
sort of, I mean, like, we can ask them questions. They're not giving us feedback with everything that we turn in with documentation until we submit it.
But Taylor's
But
calling
I
and
need-
contacting them for
Getting
clarification
information.
Right.
on different things. And also just gathering up all the information is sometimes a learning experience, which is great for her. But, figuring out, is this building ADA compliant? We know it is, but where does it say that? And finding that stuff out. Some of that just is a learning curve. We know we have the documentation. Where is it and does it meet what they consider the correct documentation?
There you go. I mean, a letter from your architect may not be enough.
Right, right.
Yeah.
Interestingly, I'll add in that Senator Laughlin was highly interested in finding out who is Fab and why are we dancing to their flute. I loved it because I like that kind of, well, why do you have to get a credit? Why is it them? Who are they? And I loved that because it's asking those fundamental questions that sometimes we just assume. And I think our answer to her was, it's the best CQI system we can get implemented at this time, which I think she buys. And that if you want to improve all the health departments across the state, and if there's something that starts to go on with that, she's had a lot of experience with it. I think your feedback to the powers that be, should something happen in this next year, will be very beneficial to kind of give them perspective of how it's improving the department and the department's delivery of services. Just gonna say, you better stick around for a while.
Hopefully so.
And it's a nonprofit entity, just for the record, and it's made up of public health professionals from across the country. And these standards were debated intensely for years before it ever came to be. And it's not, I think, what the flavor I got from her question was, is this some made up bureaucratic nonsense
Right.
that some pencil pusher put together that had no idea of what communities really need? And I think when you gave her that best CQI answer, you also included some of those things.
Yeah, I did.
And she understood better that that's not what that was. But there was a mandate. These are communities trying to provide the best public health services they can.
So this says, thank you for your consideration of Platte County Health Department's accreditation application. We fully endorse important step and look forward to the continued advancement of public health in Platte County, and I signed it. Want it back?
As long as you really mean it. Let's get rolling.
So we have some big things coming up. So we're gonna be doing strategic planning, which we'll talk about in a little bit. I think that's another agenda item. But then we also are starting a quality improvement committee and a workforce development committee, because those are two of the big plans that we need to do. And we need to have some projects related to those. So we'll be starting those the week after Thanksgiving.
Those are internal committees within the department.
Yes. Why, did you want to participate?
Love to. If it's something that the folks feel like they would embrace. I'm not going to insert myself, but I, as a board member, feel like I certainly have the enthusiasm and currently the time to try to help give some direction if there's value. I don't want to be intrusive.
I think that's fine.
We
I don't
will
see a problem.
figure out when you're buying lunch and invite you to the.
I'll buy lunch every time.
I'll go now. What is it?
But if I can, I mean, I've done so much of this myself, it seems silly not to be a resource versus the person who's alphaing this whole process. But if ideas outside the box thinking, application of business principles. Go on.
Well, as Taylor mentioned, we have a strategic planning thing. I think that will also be another area that we actually could use some significant time if you're willing.
When is
So-
this meeting?
Well, that'll be a couple day retreat, but we're going to have a lot of work to do building up to that. And so I think if you're willing, and any board members,
Just give me a heads up whenever you figure out what date and
Okay.
time and where it's at,
Yeah.
If I'm around, I don't care.
Okay.
I'm not gonna steal your thunder, dude. You can still do it.
No, just.
didn't you say you only wanted Dr.
I have a-
Shuffler?
Okay, fine.
I have a little bit easier schedule than the rest
Oh,
of you.
look, my
Yeah,
schedule got busy that
yeah.
day, all of a sudden.
And besides, deer season will be over by then.
Anything else?
We'll definitely invite all of you for the strategic planning session.
Okay.
That's the important stuff.
You got your kudos from sharing, so that was important. Susan, so I think another example of just the board working, I mean, we have been going at least a year now, that we met monthly with the finance committee. And
Almost, I think.
I think right around a year, because that's about when we finished
Maybe
our,
that was December.
we finished our
Yep.
kind of bylaws and shifted to having finance committee meetings.
Yep.
And
Wow,
I really
that's
appreciate
amazing.
it. I don't know if you get a lot out of it, but
Oh, I'm learning a lot. Yes.
but yes, I think it's a great kind of model to follow. And I know, like Dr. Chaffee, or Kingsley, you're
Mikey?
Chaffee.
Which one am I?
I get a lot out of
These
our,
are right
I've
here.
told everyone, I get a lot out of our meeting.
Yeah.
Because it helps me prepare for this one.
Right.
But I'll turn it over to you for the finance committee.
Well, yeah, and pipe in as many as you can. We met on the 12th of November, Tuesday, and Jen Snyder was there, helping us look at, we kind of reviewed the MOSA
Proposal,
RFP
yeah.
for our reserve accounts and really broke it down. I mean, she did an excellent job in terms of trying to understand what was going there and pretty much gave us a little bit of faith in moving forward with MOSIP and in terms of how they work with just work with how their system works. But we, at that point, after she kind of described things and went through the whole proposal, we're going to send out questionnaires to people that are using MOSIP now and how,
So we kind of came up with what,
I don't know,
10 to
10
15
to
questions,
15 questions,
maybe?
yes. And I think we've got a response from one area already.
We have like 4.
Do we now?
responses.
Okay, all right.
So we'll talk about them at the next meeting. I read them. I kind of read ahead. They're all really glowing. And I think one of the big things that Jen talked about was just that, this isn't typical banking. This is pretty structured. We're following the guidelines
The
from
state statutes.
the
and-
state statutes and
Whereas a private company dealing with a public, there may be some just things that aren't as monitored or as safe, I guess,
Right.
for us. So that's another plus for MOSIP.
but she felt like, we do need to do some work, not just take the RFP, and she had suggested reaching out to these folks that are already using it and seeing if they have noticed any pitfalls. And there was a wide range of some had been doing it for just like over a year, and then others had been, for have long relationships. And so we'll compile that at the next finance committee meeting
Okay, and then bring
and
it to the
come
board.
back with a recommendation.
Because that documents we're doing our due diligence.
And that's
Mhm.
almost exactly what she said. She said, you really don't want to take all your savings and put it into something you know nothing about.
Bitcoin, let's do it.
Not on the approved.
Yeah, I don't think so.
We need a whole lot of money.
It's almost specifically said you can't do that.
Oh,
Yeah. We also, I guess, we kind of discussed, we're still discussing payroll programs. Michelle would like to kind of update what we have, but our contract expires in November, here in the middle of November, so we're gonna probably go ahead and do what we have now. And I forgot the company, just
Time clock.
Time Clock, okay. And we'll probably keep with that and continue to investigate more programs.
Yeah, and I think the big thing is the interface between QuickBooks and Time Clock is not great. So there's a lot of manual things, and some of the other systems have advantages, but we have to look at it.
And then we'll be having our special budget meeting on the 4th. So, and then we'll bring that back.
Okay.
Anything else? I can't. I mean, Jen's presentation was quite thorough.
So I think you all saw the RFP. It was like this thing.
Yeah.
Yeah.
And I started reading it. Like,
Yeah.
Dan, do you understand all this? And he's like, I do, but I'm not sharing. You think I should have Jen read it for us? And he said, well, you would need to do that. And so we had Jen look at it for us.
Okay.
Anything else, Susan?
I think so.
Financial report, Cindy?
Big thing for us this month is we did hire an administrative clerk. Her primary her name is Abby Rose. And her primary function will be supporting the environmental health group and health education. And she came at a perfect time because all the permits are rolling in for 2025 food establishments.
So I know we're pressed for time, but I'm sorry. I had this comment made to me by one of the staff, but Rebecca Richardson, you may remember, was our intern in 2023 who did the salary study, and she helped this year with it too. And she said to me, you know, I just want to tell you that it really has made an impact moving these scales for these positions, or it seems to. The quality of applicants that we have gotten for our administrative staff and our health education staff, because I like the person that was in Abby Rose's position just fine, but the caliber of work is completely different. Abby's just, I forget what she said. I'm going to say stinking awesome. That's probably not what she said. But she's like, it's phenomenal. And the applicants we had for the health education position were tremendous. We had a tough decision. We had to do second interviews. And, you know, I thought you all might want to hear that feedback. That's not feedback from me. That's from, you know, a person who's been here a year who can already tell what that investment is, what difference that's making. And that all translates to what Dan was talking about, customer service, because we all know we have internal and external customers. Dr. Chaffee had mentioned, you know, it was really important to him that the HVAC be fixed because we wanted to make sure the staff, we had a good environment. Well, your coworkers have a lot to do with your environment. If you are not getting, if you get to work with the best, you feel like the best. If you, and we have great employees. I mean, we know that, but some of the positions we've had trouble, and we mentioned, had trouble recruiting some of the best, and it seems like this is definitely in the right direction. So I wanted to say thank you to the board, but Rebecca wanted to, I think that was her thing too, is that's just incredible to see this.
Heather, we appreciate the feedback.
Yeah.
And Cindy, I don't know, is that what you're seeing?
Yes, absolutely.
Because I know on the health education position, it was
Right.
really tremendous.
Yes.
And we got a great person. I think we would have had a great person, whoever we chose.
Yes, we could have. could have had a second choice very
The
easily.
choice was difficult. That's a good problem. to have.
That's a good problem.
Sometimes the hardest thing for private businesses to do is to increase pay. And they only do so out of necessity. Because if they can't get people to fill their positions, their only last resort is to increase the pay. Well, this isn't a private business, but I think having that principle where the salary study was brought to us, I think we would have been remiss in our duties to not have paid attention to it, because I think indirectly it does affect the citizens of Black County, the performance of these jobs, getting people in to do them, decreasing stress. People who feel good about what they're doing perform better. If they interact with the public, they feel good about things. So thanks for the feedback, because I think I can speak for us all up here. That's our goal.
We don't have to give the highest salaries, but we definitely should be competitive.
Absolutely.
Yeah.
Concur.
And that was unsolicited. I didn't say, tell me something good, so I can say something good to the board.
It's just telling us we're reaping what we have sown in the last year and a half. Is it gonna be 2 years for the three of us
In April.
in April? Okay.
I'll be honest, I was a little taken aback that she was so adamant that she had put that all together, correlated that together. But it was awesome to
It's a
hear.
win for her too.
Next thing would be review and approve the bills.
Okay, so everybody signed everything, everybody's looked at everything. Okay, so do we have a motion?
I have a motion that we pay the bills.
Do we have a second?
I'll second.
Any further discussion? Okay, let's do a roll call. Susan,
Yes.
Ken,
Yes.
me, yes, Mike,
Yes.
Zach.
Yes.
Okay,
Fee resolution, Cindy?
There isn't one this month.
that's this piece of paper you gave us,
Pardon me?
the fee resolution. Is that this or what was that?
No, that was the, last minute checks that we issued.
Okay, all right.
So you don't need anything on fee resolution. New business. Budget, we talked about how we're going to follow up with that. Dan, regional response trailer transport.
And you're supposed to bring pictures, remember?
You should have them.
They're in there.
I want to see the pictures.
You don't read your pack.
I told him I wanted to go inside and walk around. He wouldn't even let us go.
They have pictures from the inside.
I'm like-
You want me to describe it to you?
I'm like that little kid that has to play with the.
He's got great pictures in there, like he's trying to sell it. It looked like a Facebook marketplace ad. I'm not kidding, it was
Well,
great.
it's on there too.
Oh, it was great.
So I'll start with the pictures.
There you go.
There you go, okay.
Here's the front of the trailer, the side of the garage. The rear of the trailer has a nice ramp on it. As you can see, it's a large trailer,
It's
and that's actually a bit of a problem for us. Here's the front inside of the trailer, kind of a workspace where you can see an outlet there. I think there's another one in the sunlight there, but you can plug in computers or whatever at the workspace. And then a view of the storage area. A lot of emergency preparedness type items are stored in here, tables, chairs, cotton balls, raincoats, things like that. I believe the entire length of the trailer is about 32 feet. Our garage is about 31 feet. And so we store it outside, which is not ideal.
So how did we get a hold of this thing and how many times have we actually used it?
We got a hold of it in 2009. It was federal funding. Was it 2009? Yeah, Homeland Security funds in 2009. It really hasn't played a huge role. We used it during the flood of, I believe it was 2010, to help with some sandbagging operations in Parkville and Beverly. They we had a lot of volunteer management to do, and tables and chairs were used mostly for that event. We gave tetanus shots at that event, or those events. We used it at the mass vaccination site. It was kept inside the warehouse. Again, tables and chairs mostly. But the problem is when we get it, when we have to move it somewhere, we have to have somebody. It's generally been the sheriff's office that brings their 3/4 ton vehicle to haul it. And we've had the city of Riverside do it for us. And each one of those entities, no fault of their own, but anyway, both of those entities had traffic accidents and damaged the trailer. It's a huge trailer. Honestly, I don't know that it should have been given. These trailers were distributed to health departments throughout the region. And a lot of the health departments don't have vehicles to pull them. And a lot of the health departments didn't have trained staff or somebody that's had experience pulling a trailer. So they're kind of dangerous when you get out on the highway if you don't know what you're doing.
Andrew and I had talked about it. I guess if you go at fast enough speed, it loses.
It drives you.
Yeah, the back end starts flipping back and forth.
And that's not a good feeling. And both the last two health departments I worked at, both had these trailers. And I had to find funding to get 3/4 ton trucks to pull them for both places. And you still run into the issue of safety.
Right.
And then loading them is always a trick too. Like if you're breaking down your operation and it's long 14-hour day, you still have to make sure that everything's evenly loaded and not heavy in the back and that it's over the axles like it's supposed to be. Because otherwise you start, like I said, and I think that's probably between wind, speed, and an uneven load, it's pretty easy to pick up the back end of your truck.
Right.
So we need to approve returning this back to.
Yeah, and the good thing about that is it would still be available to us, but Kansas City Health Department would take on the responsibility of maintaining it.
So you and I talked about, let's say we wanted to keep it,
No, I read the proposal.
but it would be,
Maybe move
you
on.
thought how much money it would cost to even get it back up to where it needs to be? If we decided to keep this thing, and not give it away.
Probably at least $3,000.
So we need $3,000 just to get it to where we want it to be.
Well, the tires have super great tread, but every date code on them is expired.
Yeah.
So they really need new tires on them.
Mhm.
I don't know when the bearings have been repacked and.
Yeah, they need to be repacked.
But
And
we
then,
don't have a need or a use for this. It is sat here
Doesn't sound
and
like
we don't have the
it's not.
capacity to move it. So I'd like to expedite us getting to the decision portion of this.
Yeah, well, I just want to say one more thing, and then I agree with you, that if we do need access to it going in the future,
Yeah.
we could ask for it and
we
we
don't
hopefully will
ask
be able to
for
get
it,
it.
we're just going to be, right now,
Possibly
we're number
denied.
one on the list.
Yeah.
Then
Right.
we wouldn't, and hopefully we'll be able to budget for a small trailer to keep stanchions and chair, like, we're
And
not,
something
we haven't
easier to
really
hook
used
onto
the
a
command
truck.
portion part of
Something
it.
more reasonable.
We've used it to transport,
Right.
to set up, tents, that kind of stuff. Dustin has done several kind of emergency events. Would have been a lot easier to have a trailer with the tables and chairs and stuff instead of him filling up his vehicle with that.
Right. Okay, so we've talked about how much it would cost to keep it, why we'd want to get rid of it. If we do want to get rid of it, we can still have access to it. We covered all the bases. Anybody want to make a motion?
So I just have a couple things.
Oh,
So
go for
with this, we're sending this over to Kansas City's health department. I'm just thinking like chances that it would just be us making this request and that Kansas City's health department wouldn't, if whatever issue arose, wouldn't basically be using it for the same emergency if something came up.
Yeah,
Like-
well, then that's a.
How long is
very
it gonna
good
take us
question.
to budget to get a more appropriately sized trailer for what our needs would be?
Right. In Kansas City, and half of the residents of Platte County live in Kansas City. So
Mhm.
I think the likelihood of an emergency happening in Platte County is probably greater in Kansas City than it is in.
Sure.
Even
I
outside
think
the
it's
city.
probably hitting us both.
We
At
could-
the same time, it's probably pretty
I
likely.
know this, having dealt with scout trailers quite a bit, and pulling them for 10+ years. if we need to go out and get a trailer, either borrow, beg, or purchase, we could do so within a month. And get something that is more useful to the immediate needs, that doesn't require a 3/4 ton, half ton is very common.
That's dangerous in itself.
Yeah.
So, but from what I'm hearing, it doesn't sound like we've had a need for it. And that if there is a need, we should have access to it. If that need is typically it's gonna be in Kansas City, but outside of it, we could leave the trailer.
We could, and they would, mutual aid agreements would.
There you go.
Allow us to use it outside the city limits. So,
You bet.
Yep.
So we're not losing anything except a headache.
exactly.
Well, and that's the thing is, and I think I told Dr. Kingsley it would actually cost us $53,000 to use this trailer because I need to buy a truck to actually use it. And you know, if we get a normal sized trailer and it's on state contract, I looked, kind of depends on one of our preparedness planner. She's been looking at different things. So how much it actually would cost, I'm not sure, but we're going to try to find grant funding to buy it, not out of our budget.
And the mutual aid works, plus you can go rent Ryder trucks to meet any urgent immediate need that we won't end up incurring cost to the citizens that is not thrifty.
So every year, probably previous to the past couple, we've always rented a U-Haul for our off-site food clinics. We didn't use the trailer. So, I mean.
Right. Okay.
So that's just it. So we used it twice in probably, what, 10 years?
Yeah, probably under half a dozen, I'll say that.
Okay. And it would cost us whatever plus $1,000 just to get it up and running. It just seems to me like it would be.
Yeah.
And if something happens, we have access to Kansas City since half the county's in Kansas City.
Yeah, it is a regional asset.
So if somebody else wants to take the burden of fixing it up and paying for it, okay.
Yeah.
So,
That
yes,
sounds reasonable.
They may have uses for it that helps Platte County.
Well, they have the vehicle to pull it. That's a big difference.
Yeah.
And they already have one of these trailers.
okay. So
I'll
we need
make a
someone-
motion
There you go.
to move to transfer the regional response trailer currently housed at the Platte County Health Department to Kansas City Health Department and authorize the director to sign the necessary documents.
Do we have a second?
A second.
Do we have any further discussion? Okay, let's do roll call. Susan,
Yes.
Kim,
Yes.
me, yes, Mike,
Yes.
Zach.
Yes.
Okay.
So the next thing is the strategic planning RFP. Dr. Kingsley, if you want to start ripping those
Yeah,
open.
so
Taylor,
can I
you can-
can I open it and then just hand it down to different people
Yeah,
so they can
Taylor,
react?
you can say what those are.
All right, so we talked about it a little bit before, but our goal is to bring in an external, consultants to help us with the strategic planning process. Ideally, that person will come in, be able to facilitate some of our discussions and conversations and organize things. I think one of the biggest advantages is that that makes it so that everyone can participate. So we will have everybody at every level involved in the PowerPoint, and that includes you all as well. And it's also great to have a strategic planning consultant because they're kind of an outside opinion. They've done a lot of these and they're gonna be offering their own expertise, helping us come in, helping recommend best practices, and avoiding internal biases. So I think we got, was it 7 or 8 RFPs in the mail? So
And Dr. Kingsley had asked me quite a bit about, so what part of this strategic planning process is this doing? And I said, it's really not writing the strategic plan. It is more about getting down all the, kind of guiding the conversation and then leading, people in to talk about what's important, how we would implement our normal foundational public health services and the things that come from the chip and chop.
Okay, I'll start with the one I have in my hand right now. That doesn't matter what order I do it in, right? Okay, so the
We
one,
need to probably say who we got it from.
so this I got from Flourish Thrive Labs, Flourish and Thrive, does that sound right? Okay, so proposal for strategic planning consultant. Hopefully they have the numbers right up front. Cover letter, Let's see what they say.
If you want to just read who submitted things and then just tell the staff to
Put it in,
Okay.
review them.
Yeah, that's fine. Okay, so let's do that. So the first one is Flourish and Thrive Labs. Susan, who do you have?
Mine is from the Missouri Center for Public Health Excellence.
Porch Light Insights.
It appears to be KT Facilitation LLC or Gary Terhark, TRHARK, Facilitation LLC.
I've got Boswell.
I got the next one here. They purposely do this to make it.
Oh, we got a lot.
I know.
Oh, I was expecting like 3 or 4, but.
Yeah,
And,
Yeah, I think
you know,
it's
some of these are up to like $200,000 is what.
This one was 29.
That's right.
Taylor put in the 30 RFP that there's a ceiling of $30,000.
Okay.
Okay, so
Well, no
this
wonder.
one is EverStrive Solutions. And then we still got 2 more here. I guess.
And we got so many questions and so many emails. And I'm like, yeah, I can't answer that. So I said that'll.
One person asked 18 questions, like in one email.
Oh my goodness.
So the next one is from, was it Dios Connections? DIOSS? Does that sound familiar? Yes.
Not familiar, but
Okay.
we have them from all over the country. They're really interesting.
Okay, so this is the last one. This is from Growth Partners, I guess. See what it says inside.
Yeah, it was probably one of the most, and you could probably
This is
say.
like Christmas.
Most responded to RFPs that we put out.
that's really exciting.
Yeah, Growth Partners, that's who this one is, yep. Okay, so I would like who to take care, Taylor?
Well, we do need the board to make a motion,
Okay,
and it would basically be what's up on the screen is move to authorize the director and staff to review strategic planning consultant bids and make recommendations at the next board meeting.
who wants to make that motion?
I'll make it. I move that the Board of Trustees authorize the director and staff to review strategic planning consultant bids and make recommendations at the next board meeting.
We have a second.
Second.
All right, any further discussion? Okay, let's do roll call. Susan,
Yes.
Kim,
Yes.
me, yes.
Yes.
Zach, yes. Okay, so my recommendation is once you have them all through, nice little block, whatever form that shows all the different companies and usual, just kind of how much it costs or what they're willing, the bill will be, what their services, I'm assuming provide better services than others. So which ones like this, they do this, these other guys don't,
Right.
that kind of stuff, so that we can do the pros cons.
The Board of Services had a very excellent strategic planning consultant come in. May 21st this last year, the results of which were quite impressive. It was a company called TT2 Consulting. No, it's too late for the RFP, but they came in and had a workshop, and I was flabbergasted at the effectiveness on which they engaged everyone. And just the act of having a strategic planning meeting brought enthusiasm, cohesiveness, and seemed a direction and purpose that sort of inspired the group. So
That's the one you and I went to. They did
Yes.
breakout sessions.
we
they
did
all-
breakouts. It was
Trust exercise.
extremely well executed. I don't remember
Yeah.
what it cost, but we can get that info. But we were part of that with another board, services in Platte County. So I think we're on the right path, and the staff can put a summary together and come up with some suggestions.
So we had people from the community come in, what do you call them, stakeholders, whatever you want to call them. And then, so they got to see from our standpoint, what we were trying to do, we got to see what they needed from their point of view. It was good. Everybody was pretty happy with how it played out. Okay,
Yeah,
Next.
big shoes to fill.
Well, I'm sure Martha James, who's the current director over the Board of Services, would be more than happy to chat with you if you aren't sure what to do. And she's somebody you can email or cold call. She's good people, and her energy and enthusiasm is infectious.
So
Glad I take notes.
Uh-huh. Well, she's a really good director, and we're using her to compare you with, just saying.
Wow.
Yeah, come on, there's strawberries and bananas, all right, come on.
Just saying, I'm not,
wow.
You need sweet or you need potassium, come on, it's a little different.
Even Zach thinks you're
I don't
being
know what.
too.
Man, I don't-
no.
I'm just telling you.
If he didn't like it so much, he wouldn't do it.
So.
Okay, what's their next deal here?
So the next thing is you all have a proposal from RTI for information technology managed services. Just a little background, the health department really has no dedicated IT people or person. Michelle Rawlings and myself are probably those persons. And, to hire a full-time IT person for the numbers, between 30 and 40 staff would probably be a little overkill, but it's a little much for us to provide all the help desk support, to provide all the expertise for running the network, for doing all this stuff. Today I spent a couple hours in here because I'm having problems with the computer up here, and it just takes away from people's time. And from the cybersecurity point of view, it's also not what I'm really trained to do. So I can go through the mechanics of it, but I don't know all the things that I should be doing. We do have cyber insurance, which I believe is super important. We need to get back up and running. We have limited patient information, but just being shut down and being, that's problematic. But also just the help desk part. It's interesting. We have a network drive and we can VPN into it. So it's just like we're here.
Mhm.
Well, if you can't VPN to get the instructions that are on the network drive, you can't really, and we don't have a number to call. Well, we do. It's Michelle or I. So Dan doesn't do it, but I'll pick on Dan. At 10 o'clock on Friday night when Dan wants to VPN in and he's having problems because he got a new computer, he's calling me. While they provide 24/7 help desk services, this was bid out by the city of Independence, so they had pretty big reach when they bid that out. The city of Parkville also, about a year and a half ago, had piggybacked on City of Independence's bid process. They're super happy with it.
So I just want to make sure we don't have to send our RFPs on this, right? We're good.
It's already been bid
We
out.
already did it. This is who we chose and we're good. Okay, I just want to make sure. So how responsive are these? Let's say the computer system crashes. Do they send somebody specifically here, or is everything done over the internet? Or
Most of it with technology is done
remotely?
No,
They have a
remote in.
3-tier response. I read my package. I regret you did.
way to pick on him.
They have a 3-tier response that looks standard in the industry, and then if it's anything outside the scope of work, they do have hourly. Their initial hourly is $150 an hour, then it goes to $240 an hour.
But
Did I read that correct?
I guess my question though
Yeah,
is,
most of it, I think,
Yeah.
is 150.
so these independents you said use these guys, or Liberty Food?
Independent.
So
And
did they have any
Parkville.
issues with responsiveness or any concerns about that? I mean, were there problems taken care of almost immediately, or how did things actually happen?
So I only know about Parkville's response.
Uh-huh.
And Parkville, they originally did not sign up for the full response like this is. And she said that was a mistake.
Mm.
Having the full service of 24, they've got, departments that are open all the time. They need to always be able to reach people. She said, I would not cheap out on it. What I would do is get the whole thing and you're going to be happy. That's what Alexa told me.
So in there, Appendix A has a breakdown of the level of dysfunction and the timeliness of their response. So if the entire service shuts down, they respond within an hour. If it's not repaired within 2 hours, it escalates to the next tier of service people, which essentially is remote, but if they can't do remote, it goes to the next tier. They will end up putting people on site, hands-on.
Okay.
And it's all broken out into the 3 different tiers of support. So they have articulated the timeliness of the expected service response. It's a very good proposal.
Yeah.
Where are they located here in the city?
So they have an office in Riverside,
Okay.
but they started in Riverside apparently.
Mm.
Now most of their stuff is up north, like in Nebraska and different places. So I don't know exactly where their people are. I think
Okay.
some of them work from remote.
But they do have the capacity. They may have contracted employees who will be locally close to come on site. My clinic in St. Joe, we don't pay this much for these services. It's much, much less, but we have a lot fewer needs too. And we don't have the need to massively escalate things super fast. If we got ransomware, I just throw out all the computers, go buy new ones, put them in, and that's way cheaper for our needs. Here, that's not as easy to do because the volume of employees, plus he's being proactive to keep there from being a problem to begin with.
Mm.
And
they're gonna
plus
run-
to help with the accreditation process, they're gonna.
Yeah, I know, part of it is just based on the number of people, because you're providing help desk services, so it's, how do I get word to do this, or this isn't working, and that type of stuff.
Now, would
Which
this
is-
include slopes or
Nope.
they do
No,
their own?
Swope is on their own.
They're on their own separate
But Cindy,
computer,
would
everything.
you tell just kind of the situation this morning that you walked into?
We've had issues at the front desk where vital records are done. Her computer started acting up a week or two ago where it would just shut down randomly, maybe once a day, once every other day. Today, it shut down 4 times this morning and would take 10 minutes for it to come back up. And we do have a parts warranty with the HP, which it's still under warranty. She called and did a diagnostic for them, which took maybe 20 minutes. They still couldn't determine anything. So now we have to wipe out her computer, put all of the data onto a jump drive and run a diagnostic that's going to take over an hour. So fortunately, we have vital records backed up in the office right across from her. And that's where we'll be running vital records until we get this thing sorted out, because obviously we can't have the computer shutting down.
The mainframe it stores everything for the day, right?
So we have a server that backs up things.
Yeah.
But like that particular computer, that's separate.
Right.
And I will say, like, RTI would be the ones talking to HP. And they would be doing that whole thing.
Right.
We come out of that. She basically calls and says, I have a problem. It keeps shutting down. They'll run their diagnostics. Oh, it looks like a hardware issue. It's under warranty. And they take care of it.
Call and do all that. Okay, that's cool. All right.
One of the other things is we have a server that we have had money. We've had money to replace our server because it's old. I'm not exactly sure if it makes sense to get another server that we are maintaining or to do cloud. What's that?
Well, the problem with cloud is a recurring fee.
Right.
Problem with your own server is you got to make sure you have IT to do everything that you can get. And a lot of companies are in the donut hole, I call it, where they want to keep a server, but to keep the IT techs, to keep it up and running with the firewall, with the antivirus, the malware protection, everything else. Sometimes it's better and cheaper to pay for a cloud server, but I think larger entities with lots more users, you do get the economy of scale. You fall outside the donut hole. Now, the thing that impressed me about this proposal was up front, they say you have to meet these criteria with your server of Windows 2016 or higher, Windows Server 2016 or higher. And they run through everything saying, you need all of this to be set up. So what they're saying is, we're gonna set you up, we're gonna install all of our software that monitors, maintains. It will do updates to all the machines through the server, only the updates that they approve. So they won't always update directly, and you cannot update your workstation without their approval. So they are being very proactive to not allow certain things to go on. And I think a CQI for this entity, that being that proactive is critical to getting it set up, because then if we minimize downtime, we improve productivity. And I spent quite a bit of time looking at, I spent just 30 minutes straight on this proposal alone. And if it's meeting what your all's needs are, I think it's very robust, as long as we monitor it and get what we need.
If it's as advertised, I think it'll be worth
And it also has here, if we need to terminate services, 90 days
Yep.
notice, and there's no cancellation
Yep.
fee,
So
so.
we had talked about this in finance committee,
Yeah.
and
yes,
this
we
is
did.
a different version than you saw,
Okay,
because when we read it in finance committee, I had no idea what it meant. I don't know, if you- like, it was very confusing. I'm like,
yeah,
well, you follow that subparagraph. No, I need you to tell me what it's gonna take. So I actually had
Nice.
Jen review this. She had no concerns. She thought the 90-day
It's-
out
Yeah.
was
Ideal.
like, you
Yeah.
can't really get much better than that, because,
It's reasonable.
and then, you know, the limited liability was the only other thing that she wanted to point out, which is what she said was pretty typical in the industry, but the most we could get out of them for something they didn't do is whatever we paid to them.
Which when indirectly becomes an insurance claim.
Right.
So it's all covered.
Right.
If they can't fix it and we have damages, well, we could go after them, or we just make an insurance claim and then the insurance company will subrogate and go after them if they were really at fault.
Right. So she seemed to think there was no contractual issues with it.
All right. Anybody?
Okay. So do we need to make a motion?
I'll move
There
to
should be language. that they want.
authorize the director to sign a managed services agreement with Riverside Technologies
Do
Incorporated.
we have a second?
I second.
Do we have any further discussion? Okay, do roll call. Susan,
Yes.
Kim,
Yes.
me, yes, Mike,
Yes.
Zach.
Yes.
So the next meeting is,
December 19, 2024 at 6 p.m.
do we have
Wait.
personnel action?
Yes.
We
Yes, 3 out of 3. Read my packet.
Enough with the pack.
I've read the.
Oh my God.
That's why you're the vice chair.
How often is it gonna give you grief?
Oh my God. All right, so go for it. So we got 3 people. We already talked about them, right?
We did
Yeah.
talk about it. We just need to formally.
Okay, do we have a motion to approve?
I move to approve all personnel action as in the minutes.
Do we have a second?
I second.
Any further discussion? Okay, roll call. Susan,
Yes.
Kim,
Yes.
me, yes, Mike,
Yes.
Zach.
Yes.
Okay. Now, next meeting will be December 19, 2024 at 6 p.m. And now we need a motion to go into executive session.
We did. And we need to read the language.
Yes.
You gotta read it exactly like it says. You want me to do it? I'll do it. I make a motion to go to executive session pursuant to 610.021, 1, 2, 3, and 13 RSMO 2000. Do I have a second?
Seconded.
Any further discussion? Roll call vote. Susan,
Yes.
Kim,
Yes.
me, yes, Mike.
Yes.
Zach.
Yes.
Thank you, guys. Okay, so what did
I
you,
think, yeah, yes, yes.
there's these, yeah.